How do you treat shoulder subluxation? Typically for me, if someone comes in and they've had one subluxation, we just give them time, rest, ice, and then get back to your activities as your pain allows. We treat it like an ankle sprain. It's just, you sprained your shoulder, let's see how it goes. And then we see them back in 4 to 6 weeks. And if their symptoms are improving and they're getting better, then we're gonna say, listen, you sprained this, you didn't tear anything, and you're gonna be fine. If they're having a lot of trouble across that 4 to 6 weeks, there's no improvement, then we're gonna get an MRI. We're gonna evaluate, did you tear your labrum? Did you tear your rotator cuff? Way more common to tear the labrum in that setting, but I have seen cuff tears depending on the age. And then we go from there. If it's a chronic problem, we're gonna start with physical therapy, typically see if we can strengthen up the muscles, get you better. If you've already done that, then we're talking about an operation to solve the problem. So really it depends on how many subluxations you've had and how long it's been going on for.